Hi, this is a message to NHS staff basically. I have been informed by friends and friends of friends who work in the NHS that people are being tested for coronavirus as soon as they enter into hospital. And if they test positive for coronavirus, no matter what they die of, whether they die from their underlying illness that they've been admitted to hospital for in the first place, they are then listed as dying as Covid-19, and that somehow this government has decided that coronavirus means Covid-19. Now, I do need to explain and actually warn the NHS that if you are participating in that, if you are obeying those orders, if you are deciding that anybody with coronavirus has Covid-19, then you are participating in a fraud and you're putting the British people at risk. Because you are basically upholding a government and media narrative that we're in the middle of a pandemic. Now, as far as I'm aware, looking at all the statistics, if at any point in the last 5 years we could say we'd hit a pandemic, that would be the winter 2014 to 2015 when there were 43,900 excess deaths. Okay? Not from Covid-19 apparently, but from flu and mostly flu related illnesses. Now, you're either going to, unless you have tested a patient specifically for Covid-19, coronavirus is not Covid-19. We need actual facts and figures. And the NHS, you are a public service. You paid for by the British people, not by this government that has done nothing but rob you. And I am asking as a British citizen that you stand by the facts, by the medical facts. Just because Boris Johnson and his cabal have decided that Covid-19 and coronavirus are one and the same thing, I'm sorry. You need to explain to the government, because you're the professionals, they're politicians. You are medical experts, and we do not expect medical experts to be following government and media propaganda. Okay? Now, if somebody enters hospital and tests positive for coronavirus, then unless you are going to do another test that proves conclusively they have Covid-19, then you must not list their death as Covid-19. And that you must state the exact coronavirus they have, because it is an act of fraud to be assuming that every single person that dies with coronavirus have died of coronavirus, or that coronavirus means Covid-19, because it doesn't. And we need this confusion to end, because if we're going to deal with this new virus, we need to be sure of the data and facts in order to understand how this is operating in society, how it is impacting the population, so that we're absolutely sure that everybody who has died with coronavirus, that it is actually the coronavirus that has killed them, and that actually it was specifically Covid-19, because that's what you're looking for, isn't it? So you can say, well, these people died of this problem. So if somebody's gone into hospital with heart problems, they test positive for coronavirus, they die from the heart problems, and then you're going to list them as dying from Covid-19. Now, is that happening? I will be writing a letter to the hospital myself, to the NHS, and we need to know, because I am not happy about this, and I am very disturbed and concerned when I'm being informed by people working in the NHS that they're being asked to list everybody who tests positive for coronavirus to be assumed as carrying or Covid-19, or indeed that if they die for whatever reason, if they've tested positive for coronavirus, then they've died of Covid-19. I know people do die of flu and the flu-related problems, but you cannot state, unless that person has died specifically through Covid-19, that person, coronavirus is not Covid-19. And I am sick to death of seeing this UK coronavirus death toll, okay? We had a UK coronavirus death toll of over 30,000 in 2014 to 15. 43,900 excess deaths in 2014 to 15. Nearly 50,000 it peaked in the winters of 1996, 1999, 2000, 2001. So, we're talking very serious levels of death. The death list has not reached. Are we dealing with another peak flu season as we seem to go through these peaks? But we need to know for sure because, we're dealing with a new virus here, Covid-19. Now, unless you are testing specifically the Covid-19, I will say to you, if you are listing those deaths as coronavirus, and then the government is claiming that all these deaths are Covid-19, you are participating in an act of fraud with this government. And I am very concerned, okay, when we're facing this coronavirus bill from an alleged pandemic. They're giving themselves powers to come and take our children from our homes, force us to have vaccinations, force us to live under a police state. No, I am not happy at all. And I'm not happy if our NHS that's supposed to be there to serve us, we the people, that we the people established, we the people paid for, that this government has done nothing but crush, 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 crush. And I expect the Labour Party to be asking questions, but the Labour Party's gone. So Jeremy Corbyn, it's down to you. But I expect NHS staff to stand up for the people and stand with the people for our health, because they're talking about extending this lockdown, and I think it's going to cause more damage, more deaths, more health problems, keeping especially children in all summer, and people losing their livelihoods, losing their jobs. The stress lowers immunity. So I don't believe this lockdown is working. I look at Sweden, I look at Iceland. Iceland has a huge amount of cases. Huge amount of people have tested positive, but very, very minimal deaths. They've not got a lockdown. But Icelandic people aren't living in anything like the stress that British people are already living in and were living under before this alleged pandemic arrived. Okay? We never had all this problem with SARS, which has a 10% death rate when SARS first came into being, was first identified. So I am very, very concerned that there's this confusion here between coronavirus and Covid-19. Okay? Covid-19 is a completely different strain of flu to all the regular strains of flu, which all come under coronavirus. And I am very concerned that a fraud is being committed here. And I am going to be seeking legal action on this. And the NHS should not be taking part in any fraud. And I am very, very disturbed and concerned by what I'm hearing from people working within the NHS. And they're not allowed to tell people that, oh, actually, they died of a heart attack, but they did test positive for coronavirus, but the government's going to list them as dying from Covid-19 and scaremongering the people then. That is how fascists operate, okay? That's how we end up being governed by fascism. It just takes professional people, not, oh no, they don't want to stand out from the crowd, they don't want to say no. No, it is your duty. The Health Service of Britain, it is your duty, professional doctors and nurses who are fully aware, it is your professional duty to explain to the government, we are a free country, and no, you have got it wrong. Coronavirus does not mean COVID-19, because that is what they have listed in their document here. Okay, that is what they have listed, and I expect our NHS that was set up, established by the people, okay, paid for by the people, is there to serve the people of Britain. I expect you health professionals to stand up when the government is explaining in this evil coronavirus bill. Coronavirus means severe acute respiratory syndrome, coronavirus 2, which actually is, you know, as it states, well, I don't think I've got the link up now, but basically they're saying that this severe acute respiratory syndrome, coronavirus 2, that is basically COVID-19, and that is what they're saying. Coronavirus means that. It doesn't. So for every death that you test and you say, oh, this person died with coronavirus or they died from coronavirus, which is it going to be? And coronavirus does not mean severe acute respiratory syndrome, coronavirus 2. And it is up to you professionals to explain that to the British, to this ignorant, thoroughly ignorant government. Because they're talking now about, you know, arresting people, checking people's shopping to see if they have been out to buy, you know, if the items they've bought are essential. They're talking about removing children from their homes, removing people from their homes. They're talking about the NHS being able to administer, force people to have treatments. And even if those treatments kill them, that's okay. That the NHS, even if they make errors and kill the patients, that's okay. I'm sorry, since when did the NHS become some kind of Nazi tool that is there basically can kill people? I'm sorry, no. Okay, and I expect every single member of NHS staff to stand up and explain to the British people and to this government that no, sorry, coronavirus is not COVID-19. Okay, we need that explained very, very clearly. Because it would be the equivalent to saying everybody that got a cold or went into hospital and tested positive for a cold or any strain of flu, oh, they've got bird flu. We all know bird flu is a completely different thing, but it is a coronavirus, isn't it? So, you know, I'm sorry, there's too much confusion going on here. There's too much confusion. And we have, as a people, as a nation, been through too much. But this, it says it in the background here, you know, on this picture. Coronavirus in brackets, COVID-19 Priority Assessment Pod. What does that mean? I'm sorry if I sound angry, but, you know, I'm witnessing people under all kinds of stress. Families under stress. People have lost their jobs on the lockdown, and we're being told a pack of lies because coronavirus does not mean COVID-19, and I do not expect the NHS to be part of this absolute charade. We want the actual figures. We want to know, how dangerous is this? How many people have got it? How is it impacting the people? How can we do that when all you're testing for is coronavirus and not specifically COVID-19? So yes, I'm sorry if I sound upset about this. You know, I do appreciate the NHS and I understand that the government's putting pressure on you. But, you know, I know you're on the front line, but you're going to have to stand up to them and explain to this government that coronavirus does not mean COVID-19. So, thank you. And people, please be aware and please talk about this evil bill, you know, which is Stalin himself could have written it. That is how bad it is. And when we're looking at that level of threat on the strength of this pandemic that's based on a confusion, if that's what it's based on, a confusion, then no, sorry, no. Not when it comes to having the power to remove children from their homes and put them in isolation. And then children can even die and be cremated and nobody accountable to anybody. No, our children are not facing that level of risk on the strength of confusion over a coronavirus. Okay?